Hello, I'm going to talk about the inferior vena cava. In a general definition, it can be described as a large vein formed by the union of the two iliac veins and receives the blood from the lower part of the body, including the abdominal organs, and empties into the right atrium of the heart. In the heart, it's located in the posterior inferior portion of the right atrium. Its function is to return deoxygenated blood from below the diaphragm. Here we can see the arrival of the inferior vena cava to the posterior inferior portion of the right atrium in the heart. It's called ostium. In the abdominal cavity, the inferior vena cava runs alongside of the vertebral column on its right side. It's a retroperitoneal structure and it carries the blood from the lower half of the body. Here we observe how the inferior vena cava go on the right side of the abdominal aorta and the vertebral column. It anastomoses with the azygous vein system and venous plexus. The clinical significance of the inferior vena cava or IVC is intimately associated with compression, typically from external pressure sources. In other cases, the IVC occlusion is rare, but considered life-threatening, associated with deep thrombosis, and it is treated with a catheter in the femoral vein.
The insertion and removal of an IVC filter for the prevention. After surgery, a deep vein thrombosis can form. This is a blood clot that is created mostly because of immobility. Parts of this thrombosis can break off and travel up into the inferior vena cava. The vena cava is the main vessel that drains blood from the legs to the heart. The blood clot will travel through the IVC and into the heart. If the clot reaches the heart, it will pass through and become lodged in the pulmonary artery, the vessel that provides blood to the lungs. If this happens, the lung tissue will begin to die, and a patient will experience shortness of breath and chest pain. In some more severe cases, it may even lead to death. To prevent pulmonary embolism, an inferior vena caval filter can be placed. To do this, a small catheter is inserted into a major vein in the leg and directed into the vena cava. The catheter continues to be advanced until it reaches a certain level where it is stopped. The filter is then inserted into the catheter and pushed toward the end. As the filter is pushed out, it begins to expand, filling the vena cava. Hooks on the filter attach to the wall of the vena cava, holding it securely in place. The filter will cause no discomfort to the patient. Now as blood clots break off the thrombosis and travel toward the heart, they become trapped in the filter. Once trapped, the clots are slowly dissolved by the body's natural dissolving agents, thus significantly reducing the risk of developing a pulmonary embolism. Once the risk for pulmonary embolism has ceased, the filter can be removed without jeopardizing the patient's health. Removal of the filter is similar to the placement. A catheter is inserted and advanced up to the filter. A snare is then placed within the catheter and pushed through. The snare loops onto a hook at the bottom of the filter. As the snare pulls on the filter, it releases the hooks from the walls of the vessel. This allows the filter to easily collapse back into the catheter. The filter and catheter are then removed.
And finally, we have the diseases, and the most common is the inferior vena cava syndrome. It's a result of obstruction of the IVC, and it can be caused by the invasion or compression by a pathological process, commonly by thrombosis. It can also occur during pregnancy, and the incidence estimated in the US it could be by 5 or 10 cases per 100,000 per year. It caused debauchery syndrome, tachycardia, and obstruction by deep vein thrombosis or tumors. And thank you very much.